Pregnancy loss is a deeply distressing experience that affects countless individuals and couples around the world. The emotional and psychological impact of losing a pregnancy, whether through miscarriage, stillbirth, or neonatal death, is profound and often underestimated. This video explores the various aspects of pregnancy loss, delves into the grieving process, and emphasizes the importance of seeking support during this challenging journey. Defining pregnancy loss. Pregnancy loss encompasses a range of unfortunate outcomes, each characterized by the termination of a pregnancy before the child can be born and thrive. The primary types of pregnancy loss include miscarriage, typically refers to the spontaneous loss of a pregnancy before the 24th week of gestation. Miscarriages are relatively common, occurring in approximately 10–20% of all recognized pregnancies. Stillbirth, defined as the death of a fetus after the 24th week of gestation, but before birth. This tragic event occurs in roughly 1 in 160 pregnancies. Neonatal death occurs when a baby dies within the first 28 days of life. This can be due to various factors, including congenital anomalies, premature birth, or complications during delivery. Understanding grief in pregnancy loss. Grief is the natural and complex emotional response to any significant loss, and pregnancy loss is no exception. Understanding the grieving process is crucial for both individuals and healthcare providers to provide adequate support and care. Grief associated with pregnancy loss can manifest in several ways. Shock and denial. Many individuals initially react to pregnancy loss with disbelief and shock, struggling to accept the reality of what has happened. Anger and guilt. Feelings of anger, often directed at oneself or others, can arise. Guilt may accompany these emotions, with individuals blaming themselves for the loss, even when it is beyond their control. Sadness and depression. Overwhelming sadness and symptoms of depression, such as persistent sadness, loss of interest in daily activities, and sleep disturbances, are common during the grieving process. Anxiety and fear. Anxiety about future pregnancies, or concerns about one's ability to carry a healthy pregnancy may become prevalent. Isolation and withdrawal. Some people may withdraw from social interactions, feeling that others cannot understand their pain, or fearing that discussing their loss will make others uncomfortable. Acceptance and healing. Eventually, many individuals reach a point of acceptance, where they can begin to heal and move forward. However, the grieving process is highly individual and may not follow a linear path. Seeking support. Navigating the grief associated with pregnancy loss can be an incredibly challenging and isolating experience. Seeking support is essential for coping with the emotional and psychological aftermath. Here are some important aspects to consider. Professional help. Mental health professionals, such as therapists or counselors, can offer valuable guidance and therapy, tailored to the specific needs of individuals and couples dealing with pregnancy loss. They can provide coping strategies and help process complex emotions. Support groups. Joining support groups or online communities dedicated to pregnancy loss allows individuals to connect with others who have experienced similar loss. Sharing stories, feelings, and coping strategies in a safe and empathetic environment can be therapeutic. Open communication. It is crucial for individuals and couples to communicate openly about their feelings and experiences. Partners should encourage each other to share their emotions, as this fosters understanding and empathy. Education. Understanding the medical aspects of pregnancy loss can help individuals make informed decisions about their care and future pregnancies. Healthcare providers should be willing to provide information and answer questions. Self-care. Engaging in self-care activities, such as exercise, meditation, or creative pursuits, can be instrumental in managing grief and promoting overall well-being. Planning for the future. For those considering trying to conceive again, consulting with a healthcare provider and developing a plan can alleviate anxiety and uncertainty. Conclusion. Pregnancy loss is a painful and emotionally challenging experience that affects many individuals and couples. It is essential to recognize and validate the grief associated with pregnancy loss, and to seek support to navigate the complex emotional journey. By understanding the grieving process and accessing appropriate support, individuals and couples can find healing, resilience, and hope for the future. Healthcare providers, friends, and family members also play crucial roles in offering empathy and support during this difficult time. With the right resources and compassionate care, those who have experienced pregnancy loss can gradually move towards acceptance and find the strength to rebuild their lives. Thanks for watching this video.